IVM.
I want to thank Intel for supporting our show. We're all loving working from home, but let's be honest, there are complications. For example, getting help from IT folks if your PC is down can be challenging because you can't just walk up to them anymore. Well, you'll be happy to hear that I have a solution for you, the Intel Vpro platform. The platform comes packed with Intel Active Management technology that lets your IT teams remotely manage your systems and fix the problems without having to go to them. So it means more time getting your work done and less time spent on getting support. Visit intel.in/morewithvpro, that's VPRO, to discover how you can do more of what you want and less of what you don't. If you're listening on the IVM Podcast Android app, click the link that's visible to you now.
Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to All Things Policy. It might seem now that every day India slides deeper and deeper into a full-blown pandemic with over 90,000 cases being officially reported per day. Seroprevalence studies will probably reveal that the COVID-19 coronavirus has actually reached far more remote regions and a far larger proportion of the population than we might otherwise have expected. It seems, given all this, that the union and state governments have kind of given up on actually stopping the spread of the pandemic. I'm sure that a lot of our listeners might have noticed that our fellow countrymen and women and other people are not necessarily wearing the mask as wearing face masks as they're supposed to. Social distancing appears to be a thing of the past, and in general, business activities seem to be returning to normal, even as these cases continue to climb exponentially. So we at Takshashila, however, have some ideas on what India should do to tackle the pandemic. The rest of the world has not given up in the battle. We hear encouraging reports of clinical trials from across the world, and it seems like only a matter of time before a vaccine starts to become available to various developed and developing countries. Given this context, it's very important that India have a vaccine strategy. As one of the world's premier low-cost pharmaceutical manufacturers, India has enormous potential, not just to tackle the pandemic within its own borders, but also more broadly within the world at large. We can play an integral part in fighting this pandemic, and we have some ideas on how India should do that. So I have with me today Dr. Shambhavi Naik and Ameya Paleja. Hi, guys.
Anirudh. Hello, everybody.
So Shambhavi and Ameya have written a fascinating slide doc on what India's vaccine strategy should be, who India should be prioritizing, how we can get our hands on enough doses of the vaccine, and how we can actually deploy it to enough people to actually inoculate the population at large from the virus. But before we get into that in detail, just like to remind you all to take a look at the description. You will find a link to the slide doc there, and I absolutely recommend that you check it out. And with that said, Shambhavi, Ameya, can we talk a little bit first about what India's current strategy is? What is the global progress towards finding a vaccine for the novel coronavirus?
Basically, India's strategy at this point in time, I'm not really clear on how they're progressing about it because, like you said, that, people seem to have forgotten social distancing. Everybody's just going out. I think today, when we're recording this, they are going to resume the parliament sessions as well. So everything seems to be going on as though COVID is actually a thing of the past when it is actually not. And the number of cases are on the rise. So I think the government is finding it difficult to kind of balance the economy and the COVID infections. And somewhere they seem to have given up on the COVID infections. So I don't know what clearly their strategy is at this point in time. So maybe, we think that their hope is that, in 6 months, 8 months down the line somewhere, we might have a vaccine. And if that vaccine is available, that will kind of solve all our problems at that point in time.
I have to slightly hear that we obviously do have a expert committee that is supposed to be helping with the decisions when it comes to vaccine procurement and deployment. And we have seen ad hoc steps being taken, right? So we had that episode in August with the ICMR saying that we need this vaccine by 15th of August, which is the biotech vaccine. So they are partnering with people, with companies to at least ease red tape as per ICMR's own letter. But a clear strategy, I think, has been missing. So what you're seeing from other governments, for example, is clear indication on how many doses are they going to buy for their populace. We haven't seen that kind of commitment yet.
Okay, interesting. So what about in terms of actual progress towards a vaccine? I remember reading a little while ago that clinical trials were put on hold, I think, for the Oxford vaccine, but that seems to be more or less a normal part of the vaccine development process, right? Realistically, what really is happening on the vaccine front? Who are the players involved? And very briefly, how would a vaccine against the coronavirus work?
Yep. Okay. So world over, there are close to 200 vaccine candidates which are actually being developed at this point in time. So what is happening is, so these things need to go through different phases, like most of the listeners must be knowing by now. So they have to be tested in animal models, then they are tested in a small cohort of human population, after which it goes into the phase 3 trials, which is the most important trial, where it is actually tested for safety and efficacy in a very large population. So somewhere around tens of thousands of people. And that is where you kind of have a good signal whether a particular vaccine would work or would not work in the larger human population. So in this case, the Oxford case, what has happened is that there was one patient who developed an adverse reaction. We still do not know whether this adverse reaction is due to the vaccine or due to a condition that was existing before the vaccine was given. So these are details that need to still come out. But as per the authorities in the UK, they have given a go ahead for the Oxford trial. So the trial is progressing. This will be studied. Ideally, Oxford should give out these details within a month's time or something like that, where they say that this is exactly what happened. And these are the typical steps that happen usually. So now we just need to wait and see how many of them actually go into phase 3 trials out of those 200 odd vaccines. So if you remember, the Russian vaccine and a Chinese vaccine, they kind of skipped the phase 3 trials and they were still approved. So that's not a very good model of approving a vaccine. So we would ideally wait for these phase 3 trials to happen and then adopt a vaccine. And then the vaccine should be passed by a regulatory authority of a specific country, say the US, UK, or India, and say that this is a good vaccine. We have tested that it is safe for people. It does not cause very severe adverse reaction, and that's why it is good.
That definitely seems like a more sensible strategy to adopt than declaring that hospitals have to participate in a vaccine trial program that will come out on Independence Day. All right, fair enough. Cool. So we understand that, yes, there is definite progress towards a vaccine being there. And I think you also briefly touched upon the fact that some countries are moving towards actually acquiring doses of these vaccines proactively. Given all that, and assuming that, let's say that the government wakes up tomorrow bright and early and says, okay, let's get our stuff together and let's actually build a vaccine strategy for India. Let's get our hands on some doses. What should be the very first thing that India does to get access to the vaccine in the first place?
Okay, so basically what India would need to do is tie up with somebody who's making the vaccine. So what we are kind of banking on is that all the vaccine production is being done in-house or in India. So we have a majority share over there, which is legally not the actual thing that will probably translate to in the future. So we need to tie up with companies which are actually producing the vaccine, because they will have dosage commitments. So if the UK government is buying a significant portion of the Oxford vaccine, it's going to come from the serum stable. So through Oxford, Serum has a commitment to the UK government saying that we will supply you so many doses every month. But there is no commitment that Serum has to the government of India or to the even the private people of India saying that these are the number of doses we'll provide you every month. So that is a significant first step where either the government or, if say even an employer wants to vaccinate their people, somebody needs to do a step up saying that, okay, I want to procure so many vaccines and this is the company I want to tie up with. That hasn't happened so far. There is some information of government of India wanting to buy some vaccines, but nothing is on paper as of now.
So how would we go about actually acquiring doses from, let's say, the Serum Institute? What can we do to kind of incentivize these businesses to work with the government or with the people of India to actually make these doses available at scale?
So the best thing would probably be for the government of India to show this interest, saying that, listen, we are interested in doing population-wide vaccination, or even a subset of the population we want to vaccinate, and that's why we want to get into an agreement with you. I understand that there are certain risks to it, saying that what if the serum vaccine does not come in the next 6 months or 8 months time, it does not pass phase 3 trials. So then the government is kind of stuck. So a better way would probably be to make a open contract saying that these are the terms of our contract, where we would like to buy so many doses from whosoever passes the phase 3 trial. And that would give some confidence to these companies, saying that, okay, as soon as our drug progresses, our vaccine progresses, the government of India will buy it. So that kind of gives at least a signal to the companies saying that the Indian government is willing to buy these vaccines. So model contract, which kind of gives you details of what the government would do, how many doses it wants to procure, because you could have very large number of variables, saying that the government probably just wants to vaccinate a small set of people, say 10% of the population or 20% of the population. So that is still not very clear. So if the government actually comes out with a clear contract, or at least a model contract saying that these are the number of doses we want, in case there is some issues, we will step in, we will make the payment. So, if you want to scale up manufacture tomorrow and you need more manufacturing capacity, then we will help you, cut the red tape, as they have mentioned in the past, and bring these things up to scale very quickly. In case you have to kind of tie up with a foreign company, and say a particular company in India is just a manufacturer and they don't have any IP, but they want to go and actually tie up with a US based company or a China based company, say, and transfer the IP, then the government of India can help them transfer the IP following whatever protocol needs to be done. So those are the kind of things that the government could step in with at this point in time, at least.
Okay, that sounds fascinating, Ameya. So let's move on to the next step in the whole process then, right? So let's say that there is such a model contract in place, and there is some kind of mechanism that incentivizes producers to go ahead and start manufacturing vaccine doses at scale for the Indian population. What are the next steps that are involved? How do you figure out who is going to be receiving the vaccine? How do you make sure the vaccine is delivered to them? And how do you track the delivery of these vaccine doses and the recovery rate of these people once the delivery has actually been done?
That's a big package to uncover there.
Sure, we can take it one by one.
Yeah. So if we start off with estimating whom should we be vaccinating first, right? And there are various models that people have come out with. The WHO, for example, recommends that we vaccinate those over 65 and those with comorbidities first. Everyone agrees that healthcare workers should be vaccinated first. So, irrespective of whichever model you follow, healthcare workers will get vaccinations first. And obviously those who vaccinate others will need to be vaccinated before them. So that's a done deal. So the next question is, whom do we target after that, right? So we have given two strategies in the document. One is which is the WHO recommended strategy, and the other strategy which we recommend is based on an essential first strategy. So you first vaccinate people who are in essential services, and obviously through the pandemic, through the lockdowns, we have seen that there have been definitions and categorizations of essential services which the government can actually use for identifying essential workers. But the idea is that you do not have to compromise on business continuity of essential functions. And so it is an easier group to target and vaccinate. With the people over 65 and especially with comorbidities, it's very difficult to figure out who will have comorbid conditions. So basically identifying people with comorbidities to vaccinate is going to be a difficult step. And even if we do that, it's a pretty big population. So the WHO estimates about 20% of a country's population would be over the age of 65 plus have comorbidities, which is a pretty big population to vaccinate in the first phase, right? So you'll need to, again, prioritize there as well. On the other hand, essential services, when we looked at, say, healthcare workers, logistic workers, police, etc., we are looking at about 30 to 50 million people. So that's a smaller pool of people that we can actually start with. One of the things we have to remember with the vaccination rollout is that, look, even we recommend that we should vaccinate 80% of of India's population. However, that is not going to happen immediately because there are two bottlenecks. One which would be the actual production of the vaccine, which we have discussed right now, and the fact that India has to improve vaccine production. And the other would be a distribution system. So from now till whenever that vaccine is ready, so when we are still undergoing these clinical trials, we have to ramp up those two things as well.
Okay, all right. So those are pretty interesting mechanisms for actually deciding whom to get the vaccine to. And I agree, like in general, essential workers, people who keep the economy running are the ones who should be getting the vaccine first. But in a country the size of India with the kind of population that we have, that's going to be probably at least 100 crore people or so.
So, I mean, it depends. So, in the first phase, when we were trying to put people in, we came across, I think, about 50 million people who we could do ideally. And then obviously you can add more people if we have enough doses ready in that phase.
And how much would an exercise like this cost? I'm assuming it depends on which vaccine we end up wanting to go with, right?
Yeah, it depends on which vaccine, what is the cold chain of that vaccine, whom are we distributing it to in the first phase, where does it go, what channels do we use for distribution. It's going to be depending on a lot of things.
And how does distribution actually work in practice? Would you necessitate that people purchase doses of the vaccine for themselves? Should there be some kind of funding model where the government pays for it? Should it be made free for everyone?
Yeah, so answering multiple of your questions over here, depending on the vaccine that we probably go with and estimating that we are trying to target 80% of our population, we think that this would cost anywhere between somewhere around 50,000 crores to 250,000 crores. So the cost that is given over here, there are multiple pros and cons of it, saying that, okay, the government should pay for everything or the government shouldn't pay for everything. So what we have kind of agreed upon is that, we probably take a approach where the vaccine is made available to the people, people pay for it, and then they can actually get the money paid back to them into their accounts using a DBT mechanism, so that the vaccine distribution is done in a much fair manner. So that is what we would ideally recommend in this scenario, because we know that providing vaccines at zero cost would kind of distort the market, and there are because this will be a kind of a phase-wise deployment. So what will happen is that there will be multiple instances of pilferage, people holding onto the stocks and all that in the initial phases when the supply is going to be low. So as the supply picks up, things will get better. But to kind of ensure that the process goes on much better, we think that pricing it at a given market price and then giving the subsidy back to the people is the best approach to do right now.
Ameya, I just want to comment on those figures that you spoke about, 50,000 crore to 250,000 crore. How much does that compare to GDP or to some of the other schemes that we already have rolling out? I know the figure looks like huge, but is it really huge?
So basically, when you say that, the range that we've given is quite large, it's kind of taking into consideration kind of the cheapest doses available and the most expensive doses available, because we don't know. There's a 50-50 chance that both of them will fail or both of them will come out on top. So then it will be a option that the government would want to pick up, or government can pick up either of the vaccines. So that's how it will go. But if you look at the range, it seems large, but the numbers in terms of GDP of the country is they're very small. Something like the Mahatma Gandhi National Rural Employment Guarantee Act also spends somewhere around 71,000 crores every year. Or, if you're looking at probably the state health budgets, then those are also in the same, somewhere around 50,000 or 70,000 crores every year. So the numbers might seem huge in the beginning, but in terms of the government, they are quite regular numbers. So that's why we also think that the government will be able to kind of pick this up and say and do this, because this is a public good that needs to get out once it is available, because we cannot continue doing this, probably locking down the economy as well, or allowing cases to just spiral out of control, because by the time this becomes available, we might not be at 90,000 cases a day, we might be way, way higher as well. So it is something that the government can do, and by ensuring that we are doing it through the DBT route, the cost to the government can also be reduced to a certain extent, because the people who can pay for it and do not want to take the subsidy can also do it that way. So they say that, here is a family of 4 who's paying for the vaccine themselves, but there is a family of 4 who cannot pay for the vaccine. So that's where the government pays that money back. So there is some cost cutting for the government as well. But in terms of general numbers, this is still a very small number as compared to what annual budgets are for the government.
Yeah, I think if I can just summarize, we are basically saying that the government can afford to do this and the government should do it, but there is an opportunity cost attached to it, and we have to recognize that. And if there are people who can actually afford their own vaccines, they should have the opportunity to actually cover for that themselves.
Okay, fascinating. So if I can summarize our overall discussion so far, progress towards a vaccine is definitely happening. There are things that the government can do right now to kind of guarantee access to vaccines later down the line. There are strategies that the government can use to identify whom should be getting the vaccine doses first, and there are also ways to fund this in a reasonable enough way. But I think now we come to the really big question, right? With the kind of numbers we're talking, and the kind getting the vaccine to sufficient people is easily going to be one of the most massive projects that India has ever undertaken. Far, far wider in scale than the general election, because you're not just trying to reach out to adults, but also to younger people. And it also imposes far more constraints, because you have to maintain social distancing. You have to keep track of where the vaccine doses are going. You have to make sure that people come back in for repeat doses. There's no pilferage around the way. It seems like an enormously complex logistical problem, and I can see how it might be so daunting that the government might want to sit back and say, look, we didn't really bother to kind of rein in the spread of the pandemic. We're not really going to bother with the vaccination strategy either. But again, you guys have some ideas on how the government can actually get its act together and proactively get the vaccine out to a number of people. So how would that actually work? Can you take us through that?
Okay, so yeah, the exercise is going to be a huge logistical affair. There are multiple things, like Shambhavi said, that there is going to be cold chain associated with it. There are people in different areas that, even the remote areas, should be vaccinated, because you just don't want to vaccinate your dense areas. People are going to travel once they are vaccinated. So you want to reach out to the country as soon as possible. So that's where we propose that, a model like the Election Commission model kind of works very well, because the Election Commission staff have this expertise of actually rolling out camps so that people can vote. The population size that they cover with each election booth is much smaller, about 1,000 to 1,200 people. So these are people, if you make a vaccination booth available to them, people can actually come to these points, get vaccinated. You can maintain social distance as well. So this is a very good way of actually ensuring that most of the population is vaccinated, and the distribution of the vaccine is not a cause for actual spread of more cases. So that is something that we would be able to bring together if we use the Election Commission model. Again, the Election Commission model does not have the expertise to deliver a vaccine, so you would need the public health staff also along with you. So all people who are basically involved in primary healthcare, like ASHA workers or Anganwadi workers, these can be brought together under the umbrella agency, that is the National Health Agency. That's the model we are proposing, so that these things can happen at a scale when we want them. So if you assume that initially the vaccine production is at a much lower scale, this need not be rolled out to a full-blown scale immediately. So you can do it in smaller phases. Probably do your essential workers first and all that. And then as you're heading towards the population level, then this model can come in. You will have a good idea of how many vaccines are available. You can kind of pan it out across the country in a period of 8 to 10 months and ensure that
All right. Thank you, Ameya. That's quite fascinating. It's quite heartening to know that there are things that we already have that could make deploying a vaccine quite realistic. So let's just get on to the nitty-gritty and actually talk about what needs to be done right now. What are the actions that the Indian government should be taking? What kind of timeline are we talking about? What should we be doing in September of 2020 to get the vaccine to as many Indians as possible in the year 2021?
Right. That's a very powerful question, Anirudh. And I'm going to start off by saying that I'm not as cynical as you are about the government not doing anything. I think they're trying to. I guess it's just a huge problem, right? And it's easy for us to come up with guidelines, but I think they have their mind boggled with just the amount of details that they might have. So the suggestion that we have was that you start acquiring vaccines, you start putting out those model contracts immediately, right? With the idea that you signal to both vaccine manufacturers as well as to the public that we are going to get these vaccines. There is a timeline to it. And particularly this whole prioritization strategy, it is not going to be easy for people who have been in lockdown for months and have been waiting for this vaccine then to hear that, hey, you're not going to be in the first phase of vaccine deployment, right? Everyone just assumes that the moment this vaccine is approved, we are going to get it. And it's not going to happen like that. There has to be some plan of prioritization. And I'm sure people will understand if they know the reasons behind why somebody else was chosen to get the vaccine first, right? But we have to be extremely clear in our communication of that. And that has to start from now. So we think that public engagement has to run throughout and the entire exercise from before the vaccine is approved through deployment and even afterwards. Public engagement has to be a critical arm for the government. Then obviously start acquiring the vaccine, start setting up these model contracts, set up a structure for to oversee vaccine deployment. So like Ameya spoke about, under the NHA, have the Election Commission work with state public health administrations. There might be some legislative changes that are required for doing some of the things, and those need to be passed now. Then third is prepare for distribution. So get manufacturing capacity increased, set in the structures to distribute vaccines to all the areas that have been prioritized for deployment. And along with all of this, we are also going to require some really strong post-market intelligence on how the vaccine has been deployed, if there have been any adverse events, what lot, which vaccine was given to a certain person, etc., etc. So all of that infrastructure also needs to be set up. So our timeline is from August to say December. We need to have those lists ready. Who's going to get the vaccine first? It has to be communicated to people. We need to have an estimate of how much vaccines we are going to need in phase 1, and then make sure that we have model contracts ready for at least those doses, and contracts set up with private companies to get those doses once they have been approved, and then roll out the first phase of vaccination.
All right. Thank you so much, Doc. I'd like to remind our listeners once again that this fascinating slide doc that Shambhavi and Ameya have put together will be available in the description. So please do head over and check it out.
Hey, thanks for that, Anirudh. And I have to mention that though only Ameya and I are here on the podcast today, this document is actually a group effort. And there was a diverse team at Takshashila which worked on creating these recommendations. And those include Mihir Mahajan, Narayan Ramachandran, Sunila Dikshit, Rahul Mathan, Nitin Pai, and Pranay Kotasthane. So just saying thank you to the entire team that put together these recommendations. Thanks.
And on that note, thank you both for joining me today, and thank you all for listening to All Things Policy.
Thanks, Anirudh.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
I hope you enjoyed that show. I'd like to thank our sponsors this week, Intel. It's been a great week on the network this week. If you haven't been paying attention, please do listen to some of the shows. We had Chetan Bhagat. This was the first returning guest on Cyrus Says. Do check that out. Great episode. We had Palak Zatakia on Advertising is Dead. Really interesting conversation was had with Varun. We had another crossover on the habit codes. Zarina Poonawala showed up over there to have a discussion with Ashton about anxiety and pressure. Begin the Journey with Ashish Vidyarthi continues to kill it. Please definitely do check it out. An old friend, Vijay Koshi, was on Storytellers and Storysellers. Do check that out as well. And I'd like to mention one thing. If you're a Tamil speaker, you should definitely check out our podcast, Kadai Podcast Punyan Selvan. Kavita Jiva has done a fantastic job to finish up her first story. It is the last episode which just came out last Monday. Do check it out if you speak Tamil. It is an incredible achievement. Please do check that out. And with that, hope to see you again next week.
Hi, my name is Anupam Gupta. I'm B50 on Twitter. I am the host of Paisa Vaisa, the show that talks money. On my show, I speak to experts from every field of money and finance, from stock markets, equities, debt funds, credit cards, life insurance, every possible area of money and finance that you can think of. We even did an episode on cryptocurrency. I've got fantastic guests from mutual funds to personal finance experts everywhere. Robo-advisory, startups, just name it, we've got it. At Paisa Vaisa, we help you make smart decisions about money. You work hard for money. Now make your money work hard for you. New episodes out every Monday, and you can listen to my show on the IVM Podcast app or any other podcasting app that you have.